name is Mary Olano, and the people in my group are Chelsea Kennedy and Apple Rose Manzano, and we are doing travel nursing. So a travel nurse is someone who is hired to work at a specific location in a limited amount of time. Typically, they work for 13 weeks in one area. And the requirements, you have two options. You can get your associates in nursing, or you can get a bachelor's in nursing. And then you pass your NCLEX, you become a registered nurse, and then you have to gain your experience. Typically, you have to have 18 months of experience, and depending on your specialty, for some specialties, if you have a specialty in med-surg or psych and rehab, your minimum is 2 years, and if you're an LPN, you have to have, typically you have to have a minimum of 6 years. It all just depends on your specialty and where you want to work. And then you have to choose a nursing travel agency. So for national certifications, the NLC, it's called NLC, Nurse Licensure Compact. It allows nurses to practice in other states with a single multi-state license. So for the states in blue, if you want to travel from, for example, Arizona to New Mexico, you don't have to get a lot of, you don't have to start over and get a new license. You can just have one license and travel from between these states. And then if you want to travel to the nurses that are, to the states that are gray, if you want to travel from Arizona to California, you have to have a license in California. So what is the Nurse Practice Act? It is a set of laws that have guidelines to make sure that nurses are competent and that they are qualified. And it says it's a guideline for nurses to follow to protect the public from harm. The Nurse Practice Act determines the scope of nursing practice, so what you can or cannot do, your licenses, your titles, requirements for your license, the educational program standards, and disciplinary action. And each state has their own NPA. Their state legislatures write them.
Okay, so what is a travel nursing agency? So basically, if you want to become a travel nurse, you have to go through an agency, since they are the ones who match you up with a job at the facility that you want to work in or the location that you want to work in. They are your actual employers, and in the agency you will meet with a recruiter, and basically with this recruiter they will help you with your housing and travel expenses. They will help you with getting your license, and also they'll try to provide you with the best benefits and payroll services within the locations that you want to work in. Okay, so a travel nurse, usually you will get $75,000 per year, and that is based on a 48-hour work week, and usually per hour you can get up to $40. According to the Bureau of Labor and Statistics, there will be a shortage of 1 million nurses by 2020. Okay, so housing dilemma. One of the main concerns with being a travel nurse is worrying about how to pay for housing, or even just how to find where you want to live at. However, the cost of travel and living arrangements are typically included in your job, so you don't need to worry about this issue. Okay, some advantages of travel nursing include traveling, it's flexible, you get bonuses, as well as paid expenses. So traveling is an obvious advantage. Oh gosh. Okay, never mind.